Welcome to Hebe Medicare Cyprus podcast. I am Emilie Pery and I'm very happy to have you here with us today. Today I'm honored to welcome to our facilities Dr. Menashe, one of the biggest names in the facial or in the plastic surgeon industry in Israel. Came specially to conduct a training to our community of doctors. Welcome, Shaked.
Wow, I'm very happy to be here in Cyprus. I'm happy to share my knowledge and my experience in plastic surgery.
I'm very happy that you're here. I know you personally, and I know some of my friends that's been operated in your theater. And I can honestly say that you're one of the biggest names in Israel. And for me, it's a privilege and it's a big honor that you're sitting here next to me today and that you came all the way here to be part of our education center. So thank you for that. So today, we're going to dive into the world of fillers. So facial fillers are no longer just about adding volume. They require deep anatomical understanding, precise technique, and a long-term vision of facial aging. In today's episode, I'm joined by a board-certificate plastic surgeon, Dr. Menashe, to explore fillers from surgical perspective when they elevate facial harmony, when they compromise it, and how to use them safely and intelligently over time. We'll discuss anatomy, aging, complications, and why fillers alone are often not enough. This is a conversation for practitioners who want to move beyond trends and Instagram and towards the aesthetic medicine world. Before we start to dive into the topic of the fillers world, I want you to share with our audience, please, a little bit about yourself. Who are you, Dr. Menashe?
Okay, so my name is, like you said, Shamir Menashe. I'm a plastic surgeon and I'm a senior at Hebe Medical Center in Israel, one of the biggest hospitals in Israel. My specialties and the surgery that I'm focused on is the facial rejuvenation, facelift. I do breast, I do body contouring, and the world of post-bariatric surgery to remove all the excess skin and reshape the body. As a plastic surgeon, it's very important to understand that I can combine those two worlds, the fillers and the surgery world. It's not about the questions of either to do a surgery or either to do a fillers. When you want to do the perfect result, you need to combine those two worlds. With a scalpel, I can remove excess skin, I can reshape the face. But one of the things that in order to combine the treatment and to have a perfect result is the quality of the skin and the quality of the soft tissue. Today's topic is the combination of aesthetic surgery and the fillers, and how can we combine those two treatments in order to achieve a better result.
A better result. Do you see today's solutions different than, for example, 2-3 years ago?
Yes. There are a lot of technology like laser, ultrasound, radiofrequency devices that when we looked at the past, we didn't think that it can be possible without surgery. And now with a laser, for example, we can do beautiful things without using the scalpel. And in order to have a better result for the patients, you need to know all those technology with the filler that you have and with the scalpel. And you need to know when to combine those treatments in order to have, like I said, the perfect result, the perfect solution for the patient.
And the perfect harmony. So let's dive into the filler world. My first question will be, I think, the most important one. What does the one thing most practitioners are still misunderstanding about fillers and also after years of experience they're missing?
In my opinion, there are two things that are very important. First things is the anatomy of the face. You need to know exactly where are the ligaments, where are the fat pad, where are the muscles is. In order to achieve a better result for the fillers, you need to know exactly the anatomy of the face. And another aspect is the filler itself. You need to know which fillers goes to where.
Exactly.
Not every skin booster can lift the tissue. And you need to know all the fillers that you have in order to have the perfect result.
So as a plastic surgeon, how do you decide which fillers is better for which area or different ages of patients? I mean, in their 20s, in their 30s, in their 60s.
So as we age, a lot of things change in our face. I mean, the soft tissue, changing in the soft tissue and changing in the skeletal of the face, like the bone.
The bone.
I'm not trying to change someone. I'm trying to redefine his beauty.
Beautiful.
It depends on the age of the patients. And sometimes a patient that is 50 or 40 years old maintain their volume. And it's not about the questions of age. It's the questions of what you want to achieve with the fillers.
So if you know how to choose the correct filler to the correct area, in any age you can have the same results?
Not the same result, but it depends on the quality of the fillers. For example, here we have a beautiful filler with safety and accuracy for the result, which are very important for me as a plastic surgeon to have the best quality of filler that I inject for my patient. And again, it depends on the treatment that you want to achieve. For example, if you inject it for the lip, it's very important that the filler would be soft. I don't want to be so hard, and every time that the patient is eating, for example, or speaking, for example, he will feel some bumps and humps in his very delicate lip. And when I want to have some lift and volume, for example, I inject it deep into the tissue. So it's dependent on the result.
Different density and different material will go in different layer of the face according to the results you want to see.
Correct. And this is the most important thing, like I said, knowing the anatomy of the face and really understand the filler that you have and where you want to inject it for the face in order to achieve, again, the perfect result.
Let's talk a bit about complications. Give me one or two highlights about how to avoid complications during a treatment like that.
It's a very important question that you asked, but there are a few things you need to understand. Knowing the anatomy, it's critical. And knowing the filler that you inject, what you want to achieve from those materials is very important. Speaking about complication, there are a couple of things that you need to know. The immediate complication that are happening in the 24 hours post-injection, and there are complications for long-term complications like edema and fistula that you are interrupt with lymphatic drainage underneath the eye. But the most important thing is knowing the anatomy and knowing the blood vessel and to avoid injecting those filler into the bloodstream.
So, why do fillers alone sometimes will not be enough, and in which cases you would recommend to add to the protocol of the treatment you chose for your client, also skin booster, biostimulator, in order to achieve the results that they're looking for?
Okay, let's say that fillers sometimes are not enough. When there are a lot of sagging, when there's a lot of excess skin for the face, and whether the marionette are too heavy, for example, and the nasolabial fold are too deep into the tissue, sometimes I recommend having a facelift, surgical intervention, and then, but I explain it to the patient that, and like I said, the scalpel cannot improve the quality of the skin. This is something very important that I explain to the patients. I can remove excess skin, I can reshape, I can move some fat pad from one place to another, but the quality of the skin, it's something that the scalpel cannot treat.
And when you say quality of the skin, you're talking about what?
About the productions of collagen, the production of elastin, the quality of the skin itself. As we age, every year there's 1% less productions of collagen and elastin. And this is something that I explain to the patients. I cannot
reverse the years.
Stop the aging, let's say. I cannot stop the aging and I cannot reverse the time, but I can slow it a little bit. And this is what I explained to my patient when they came to me and they said, okay, bring me back to the 40s or 30s.
So even after a facelift, it's still important to help the skin reproduce collagen and elastin. And there's a way to do it.
The skin rejuvenation and the soft tissue rejuvenation, this is the next level. This is the next level of fillers. This is the next level of facial treatment. Aesthetic medicine are going toward this approach and to stimulate the productions of collagen, elastin. The target is fibroblast in order to produce more of those good things for the face.
So how important it is, while injecting cross-linked hyaluronic acid filler, that the tissue will have enough collagen and elastin?
When you stimulate fibroblast, you need to have a certain amount of fibroblast in order to start the process. When you want to increase the collagen or the elastin, you need to have a certain amount of fibroblast in order to produce the elastin. Those are the most important things to understand and to, let's say, analyze, then to do a patient selection for those treatment in order to have the best result. Younger patients, obviously, they have a good quality of skin because they have a lot of elastin production and collagen production. As we age, like I said, every year 1% of our factories, of our fibroblasts are degraded. This is something of things that the patient need to understand. Sometimes the patients came to me and they said, okay, I want to have that kind of treatment. And I said, okay, I cannot bring you to this kind of treatment, and we need to do some kinds of expectations. I mean, what they want and what I can bring them, and to see if they're fit together. Sometimes I see that the patients with high expectations and they think they're coming to me and
this is not realistic.
And it's not realistic result. And I said, okay, I cannot bring you to the solution, but I can give close to what you want. And I always lower the expectation in order to not to disappoint them after the treatment.
Mm-hmm. I think this is very important. This is the loyalty between the practitioner and the client. You need to build that path in order to have a long-term relationship.
You need to build that trust between the patient and the physician. Mm-hmm. And the trust is something that you need to build over time. I mean, it's not just one-time treatment and then you build the trust with the physician.
So who decides where is the time to stop? Like, did it ever happen to you that a client came in and he wanted to do something and you're telling him, I'm not going to do it to you?
I do it a lot. I mean, sometimes the patient, let's say they came to me and they said, okay, I want to have that kind of surgery because I want my body to look like that. And I said, no, it's not proportional to your body, or for the face, for example. It's not proportional for the whole body. And that's no, that is the way I want. I always say to them that on my hands, it's very important that the treatment would be proportional to the body. The surgery would fit to their body. And this is something that I see when I'm performing a surgery or aesthetic treatment.
Tell me, please, how does your approach to facial fillers are changing between women or men that they're on their 20s, 30s, 40s?
As a plastic surgeon, I know a lot about fillers, I know a lot about technology, and I know a lot about surgery and what the scalpel can do. And it's not about the questions of either this one or this one or this one. It's the questions of combining all those approach in order to have the perfect result. I mean, sometimes I focus more on the surgery and less on the filler. Sometimes I do minimal invasive surgery and then I do focus on the fillers. And sometimes I focus on technology and not on the fillers. It depends on the request from the patient and what I know from my knowledge would be the best for him.
So all the treatment strategies changing according to the age and the condition and the results they're expecting to see.
Correct.
Realistically.
Correct.
Tell me, please, in your practice, for example, how common are fillers? Is it still one of the biggest demands in the market today? Or people are going more towards skin boosters, biostimulators, etc.?
I mean, the world now is going toward the biostimulator. The magic of pushing the body in order to produce more collagen and more elastin, this is where the medicine, where the aesthetic medicine is toward. You can add some volume and you can add more of the skin booster and do some kinds of softening the skin, for example. But in aesthetic medicine, pushing the body in order to produce more of the material, more of the new collagen, new skin, this is where the medicine is going now. And with the technology, we can stimulate fibroblast. With the fillers, we can stimulate the fibroblast, and the fibroblast are the key for the aesthetic medicine.
Is it true that when the client has more collagen and elastin in his face, the hyaluronic acid fillers and the volume that you're adding to sculpture his face will stay longer or better?
It's like a scaffold. I mean, you need to inject the filler into something. You need to have some kinds of soft tissue in order to accept the filler. Knowing the anatomy, you can understand the right places in order to inject the fillers. And sometimes I can do full face with less filler because I know exactly where to inject the filler according to the ligament of the face, according to the right place, either deep into the periost or superficial under the dermis. So I can do full face treatment with less fillers because I understand the anatomy of the face. And it's not just about adding volume. Is adding the volume to the right place.
To the right place. And sometimes treating one area will be by giving a solution to another area.
I mean, sometimes treating the nasolabial, for example, sometimes the patient said, okay, I need a volume here.
Yes.
And then I said, no, if you want to have the perfect solution for the nasolabial fold, you need to inject it to the cheekbones or to the temporal area. And they said, okay, what is so they asked me, okay, what is the connection between the cheekbone and nasolabial? I want it here.
Yeah.
It's something that you need to build the trust between the patient and the physician. And you need to build, when you are doing a full face treatment, like I said, normally I do it with 2 or 3 fillers at a session. And then I invite the patient again 2 weeks later, and then I continue the treatment. So my approach to the full face treatment, and like we are going to have the demonstrations today, is to work step by step in order to achieve, again, the perfect result. Because the patients came, they don't have time. They said, okay, I'm here, do whatever you want. I want it fast, I want it less filler, I wanted a cheap treatment, I want it without bruising. And it's not something that can be done at one meeting. So it's something that needs to build over time. And it's very important to understand that when you inject the filler, you see the final result in about 2 weeks or even 3 weeks. So when you do a full face treatment in one session, you cannot precise the treatment, because the filler are still working.
You cannot see the final result.
You cannot see the final result, and for me, I don't want to have the final. I want the perfect result, and the perfect result would be to inject a few syringe, and then invite the patient after for a checkup and even a small correction, and then treat another area in 2 or 3 weeks post treatment.
Amazing. I would highlight this as your golden rule for new practitioners, new physicians that are starting to do aesthetic medicine injections.
Because sometimes the patient is calling me and said, okay, remember me, we inject a few fillers 2 weeks ago, but it's asymmetrically. I mean, one cheek is bigger than the other one, is more volume from the other one. Less is more, let's say. Step by step, in a step manner. I mean, the physicians can have the perfect results.
Safer and elegant results.
I mean, this is my opinion. I know that there are some physicians that are injecting 6, 7, or even 10 filler in one session. This is something that I'm not doing, but I mean, it depends on the physicians and what he thinks and what he believes.
Exactly. Everyone is bringing his own philosophy. And
Correct.
at the end of the day, every doctor should take and build his own world. My last question is a bit tricky. But we are creative people, so I wonder what would be your answer. So if you had to erase all the filler work you've ever done and were left with just one filler, one syringe, and one facial area, where would you inject it and why?
It's very tricky questions, because as a plastic surgeon, when I look at someone, I want to have its harmony, and it's not about the questions of one filler. I mean, it's like you ask me if I can do breast augmentation only on one breast. But for your questions, I think the lip, it's a very delicate area.
It can change the whole face.
sometimes when I do even half of a syringe or even one syringe for the lip, it's changing the face. I mean, the patients came to me and said that they're having a wonderful experience, and the people around them are asking them, "What did you do? It seems like you're having a facelift just by adding one filler to the lip." So I think the lip, it's very one area that can change
The whole appearance.
the whole face. And the rest of the filler that I have for the lip, I will inject it to the cheek.
To the cheek. Okay.
So it's one syringe for the
Two areas.
And yeah, but I think one of the things that I'm gonna speak today about in our lectures and our meeting is the proportion of the face. And it's not about adding volume; it's the adding volume to the right place in order to achieve the perfect proportion for the face. I mean, it's some kinds of a canon to the body. I mean, the proportion between the upper and the lower lip would need to be very precise, and the proportion of the cheek and the chin would need to be very precise in order to have a beautiful and harmonic result.
Do you have a special, by the way, a special approach to lips injection? Like,
yeah, I do.
One doctor is calling it French kiss, the other one Cupid, the third one. There are many philosophies.
It doesn't matter the name. It's depend on where you put the material. You can call it whatever name you want, but in order to have, I'm changing my approach according to the proportion of the face. I'm not treating just the lip.
Yeah.
I'm treating the lip that are part of the face, that are part of the body. And this is what I'm doing when I'm doing a surgery, for example. I'm not treating just the breast. I'm treating the breasts that sit on the chest, that are part of the body. And I always do it. I'm trying to find the right approach in order to have the proportional result for the lip, for the face, for the cheek, for the chin, and trying to have harmony result for the patient.
This is beautiful. I love the answer. So thank you so much.
Okay, my pleasure.
It was a pleasure. And me personally, I took many things from this conversation. Thank you for being here with us. For all of our audience, our community of doctors in Cyprus and worldwide, we're going to add the link to the Instagram page of Dr. Shaked Menashe, so you can follow him up and continue to see his work.
And if you have more questions, please ask me at the Instagram. I can follow you, I can advise you, and I can be part of your clinic.
Thank you. Thank you so much.
Beautiful.